healthcare executives are currently facing a critical inflection point. While 80% of leadership teams plan to increase investments in AI for remote patient monitoring this year alone, only 35% of physicians feel they have been adequately trained to use these tools. This massive gap between strategic intent and clinical readiness is the primary hurdle for the next generation of healthcare delivery. We are moving beyond the era of simple telehealth toward a world of hospital-at-home models and predictive remote care, where AI is no longer a luxury but a foundational layer of the clinical infrastructure. For CMOs, CIOs, and VPs of Clinical Operations, the challenge isn't just about selecting the right software. It's about fundamentally reskilling the workforce to move from manual data collection to managing AI-driven insights that can reduce hospital readmissions for chronic conditions by up to 20%. In this video, we are going to dive into the 3 high-relevance shifts happening in AI-enabled remote care and how you can position your organization to lead in this new distributed care environment. The first major shift is the transition from simple data capturing to pervasive AI integration in remote diagnostics. We are seeing a move toward autonomous analysis of medical-grade data captured in the home.